The next speaker we have is Zaid Noorsumar, who's a journalist who has contributed to CBC, Canadian Press and Rankandfile.ca, and he covers in-depth coverage of working conditions in the long-term care sector, and he's going to give us his observations. Take it away, Zaid. Thank you. Okay, there. Now I think I can hear you.
Okay, I was just saying all the presentations so far have been amazing, and you folks are a really hard act to follow, but I'll try my best. I'm going to talk about the structural issues in Ontario's long-term care sector. I think there are two main components that we need to understand. One is underfunding and the other is privatization. Ontario has the lowest number of hospital beds per population across Canada at 2.3 beds per 1,000 people, which is even lower than the US. They are at 2.8 beds per 1,000 people. In comparison, the average across OECD countries is 4.8 beds per 1,000. Over the last 25 or 30 years or so, the massive reduction in the number of hospital psychogeriatric beds and chronic care beds has meant that patients, especially those with complex needs, have been downloaded onto long-term care or the home care sector. One major reason for this is that chronic care and psychogeriatric beds cost a lot more than long-term care beds. So it's been, part of the effort has been to save money as part of the austerity regime of the last 25, 30 years of neoliberalism. At the same time, the province has not invested in long-term care capacity. In 1989, Ontario had about 59,000 beds. Today we have 79,000. And therefore, the wait list in long-term care is about 35,000 people, which might unfortunately change a little bit now because of the COVID crisis and all the deaths. But what's happened is that because of this wait list, only people with the most severe needs get into long-term care homes. And so the population in long-term care today is significantly more frail and more vulnerable than the residents, say, 20 years ago. This means that the residents require a higher level of care. At the same time, staffing standards have not gone up significantly. Experts recommend a minimum standard of 4.1 hours of care per resident per day. However, based on 2016 figures, the last year for which data is available, the staffing level was 2.7 hours. So there's this massive gap between what's needed and what's available. And Ontario hasn't had a staffing standard since the Mike Harris government got rid of it in 1996, even though there's been a lot of advocacy by unions and other advocacy groups to restore that standard. The Liberals and now the Tories have resisted those efforts to institute a staffing standard. And what that means is that residents with dementia and other serious conditions tend to act more aggressively. And because of short staffing, workers don't have that time to form relationships with them. And the residents, they're often neglected because they, for example, might be sitting in a soiled diaper for a few hours, and they tend to behave violently. And between 2011 and 2016, there have been 29 homicides in long-term care. Moreover, residents also tend to act violently towards the workers. So sexual assault and other forms of violence are quite common in nursing homes. And as Simran and others mentioned, most of these workers are women, 90% are women. According to a QP survey from last year, 44% of the workers, women workers in long-term care, faced at least occasional violence in long-term care. Not surprisingly, the injury rates in long-term care are very high. And because of the racialized workforce, and I believe a predominantly white resident population, there's a lot of racism as well. One reason we don't have a staffing standard is because the for-profit lobby has consistently opposed it, as that would mean less money for profits. The other problem with underfunding, and this also relates to privatization and has been alluded by previous speakers, is that the women who work in these homes are increasingly precarious in these very difficult, very onerous, low-wage jobs. and they often tend to be part-time, so they have to work multiple jobs. And this has, of course, been a big problem during the current pandemic, as workers might have been spreading the virus by going into multiple homes for work. As of last week or earlier this week, the Doug Ford government has now mandated that workers cannot work in multiple homes. But it's been too little, too late. In terms of privatization, 58% of homes in Ontario are for-profit. The rest are either nonprofits and municipal homes, as mentioned. Now, all homes in Ontario, regardless of ownership, are funded at the same level. But to generate more revenue, the for-profit homes tend to have lower levels of staffing, which results in lower quality of care, and as a consequence, of course, more violence for the women who work in these homes. Over the years, there have been numerous academic studies showing a link between for-profit delivery and inferior quality of care. For-profits tend to have more verified complaints, higher rates of hospitalization, and higher rates of mortality. The for-profit companies don't just own homes, some of them are just management firms. According to an academic paper from 2015, 18% of non-profit homes were managed by for-profit corporations. This trend of corporate chains managing non-profit and municipal homes, as well as smaller independent for-profit homes, is relatively new, but is consistent with growing corporate consolidation in the sector. During the Mike Harris era, the government introduced subsidies to build new long-term care homes, but allowed companies to own the assets after the completion of financing, which takes about 25 years or so. This is one reason why there are many real estate investment firms in the long-term care sector. Moreover, many of the big corporate chains in long-term care are also in the retirement home sector. One reason is that the province hasn't invested in long-term care capacity. As only 20,000 beds have been added to the sector since 1989, the lack of public investment and the consequent demand for assisted living spaces for seniors has meant that there has been a demand for retirement homes which are almost completely unregulated and can charge market rates. Whereas with long-term care, the government sets the rates and ensures everyone has access, although the government subsidy is means tested. So in other words, the lack of public investment has opened up an opportunity for the private sector. A good example of a big corporate player in the seniors care sector is Chartwell, which owns and manages 28 long-term care homes, but it also owns and manages 172 retirement homes across Canada. I'll end my presentation with a fun fact. The chairperson of the board of directors at Chartwell is Mike Harris, the former Premier of Ontario.
Wow, that's incredible. Thanks so much for that. Really incredible.